Okay, well, thanks for having me. I'm going to talk a little bit about the Asian longhorn tick, how to know if you have it, what potential options you have to control it. And we're also going to speak about the pathogen that it transmits, and that is Theileria orientalis, what it looks like, symptoms to keep an eye on, and kind of what your recourse is if something happens. Okay. So it's been in the news a lot. The Asian longhorn tick has been moving rapidly westwards. First sort of known infestations were in about 2017, but we think it was probably around longer than that. And so in blue, you have the states where we had confirmed uh, outbreaks in 2025. And so, right, to add three new states to something that can't fly is actually quite impressive from the tick side of it. And so the reason why this tick is different and special, and really why it's managed to expand its range as much as it has, is that unlike other ticks, this tick does not need to mate. And so all our other tick species that we have, a male tick has to find a female tick, and they have to find each other on the same animal. And they have to, if you think about if a female tick goes and cements itself in at the ear of an animal and the male tick comes on at the heel of the animal, how does it find its way to a mate, right? Because we're anchored in. And so the chances of a male tick and a female tick finding love and making a new generation of ticks is actually really low. This tick is the ultimate feminist tick. She decided that she didn't need no man, and she actually reproduces without mating. And so she will produce 1,000 clones of herself. All of those are female, which means they will each produce thousands of clones of themselves. So we have this tick that doesn't need to follow the traditional mating system. And it also has a really wide host range. So it will feed on our livestock. It'll feed on our dogs and cats. It'll feed on humans. It will feed on rabbits and mice and deer and all sorts of things, even occasionally birds. And so it really is not very picky, and it doesn't need a mate. So this is just the perfect combination of things if you want to set up in infestation. They really do like our livestock, though, and so this is where it becomes a problem. So really, all you need is a single tick to be introduced into your area for a population to establish. And this is what makes control of this tick really, really hard, and why when we start to think about tick control, everybody's gut reaction is, I want to get rid of them all. Realistically, we cannot get rid of them all. And so it's really about, how do I manage my tick population so that I'm not having outbreaks of disease and my animals aren't covered in them, but then I'm keeping enough around to keep that natural immune response in the animals. And so when this first came to the United States, some very, very clever people took a look at where this tick's natural range is and what the climate is, and overlaid that on the United States climate. And if it's dark red, it's 3 out of 3 models agreed that this was a great place for the tick. As we go lighter, the number of models that agree reduces. I will say that so far the tick has stuck to this distribution, whether it's red, dark orange, or light orange. And so you might be looking at your map and you think, okay, if you're in Wisconsin, you look pretty good, right? That's mainly open. And if we look at the sort of global the national map, it is in surrounding states, but we haven't had a confirmed identification from Wisconsin. You probably have it. It just hasn't hit the radar yet. So even though a large part of your state isn't what we would consider great tick habitat, it is important to know that Theileria orientalis has other ways of getting from animal to animal. So even though you may not have the tick, you may still have to keep an eye out for Theileria orientalis. We've got some great research coming out of my lab that shows that stable flies we've at least found Theileria parasites in the mouth parts of stable flies. And so we think that much like they can transmit anaplasmosis, we can have fly transmission of Theileria. The lice that feed on blood have been shown to transmit this very, very well. And this is a concern in our younger animals, usually in our pre-weaned calves. And so this is something that we want to just keep an eye on. There is some records of placental transmission, so a mama giving it to her baby. It usually happens in less than 2% of cases, so not super high, but something to still keep an eye on. And then we also know that needle transmission does transmit it from one animal to another animal. So if you're bleeding an animal and you use the same needle, you can transmit this between animals. So how do you know if you have the tick? Well, it's tricky because it looks like just a little brown jobby, right? And we have other ticks that are little brown jobbies. So if you find a brown tick that looks suspicious, it could be an Asian longhorn tick. It could also not be the Asian longhorn tick. If you ever want a tick identified, pop it in the mail and I'll put your phone number on it too, and I'll give you a call and I'll tell you what tick you have. The larval stage, the nymph stage, and the adult stage, we've got the 3 stages which are typical of the of ticks in general. They're about the same size as any other tick you've encountered. So if you're concerned and you just want to know, please do feel free to send me your ticks. What we've noticed is that in generally infestations go unnoticed for the longest time. Unless you are overwhelmed with the number of ticks, which is honestly fairly rare. For most places, the tick burdens aren't terribly high. You're not going to know that you have it, right? It's going to just be, well, you've got a few ticks. What's different? But in these cases where we do get these super infestations, the number of ticks are astronomically high. And remember, this is because every single tick is a female and every single tick will lay thousands of eggs. So your reproductive capacity is just much, much, much higher than any other ticks. And so we would, in places where we've seen these infestations, you get out of your vehicle, you walk 10 paces and you've got hundreds of ticks on you. So in this sort of you can see them here, they're up on the seed head. Over here in this sort of the third picture here, there's 70 ticks alone on these 2 blades of grass. And you can see them also here, just astronomically high levels of ticks. And so normally what we actually notice is it's on the animals first. And so this is a bull, and you can see that he has just huge numbers of ticks up in this ear, on the tail, where the hairs start to grow out and sort of along the inside of the legs, also in the sort of armpit area. And you can kind of see here, it may not show up if you're on a small screen, but this area gets a lot of chafing. So we had there's actually blood there. And as Wisconsin is pretty far north, and so we're not necessarily worried too much about the New World screwworm being an issue for you guys. But this is something to keep in mind if you were in a more southern climate, where we're trying to make sure that we don't have wounds on our animals. And here you can see it on the tail head, just an astronomical infestation. And so, it's a burden on our larger animals, but we really want to keep an eye on our smaller animals because each of these female ticks is taking a really large volume of blood. And so when we have these high infestations, smaller animals in particular can have significant blood loss. Here we see it on a female, and you can see here that around the udder area, there's just a mass inundation of ticks. If you can imagine, if she's trying to nurse, this area is really, really painful, and she may not want the young and suckling on her, and so we may see issues there. And here you have it in the dewlap of this animal. So if you have an infestation, you will know about it. Just as a side note, some of us have particularly hairy animals, and you may not notice all these new ticks on it. So just keep an eye out for animals who are doing things like scratching and excessively rubbing on things, excessively licking. That might be an indication that there's something going on that we may want to take a look at. So what can you do if you have it? So here in Kansas, we set the Flint Hills on fire every single year. We're very, very comfortable with burning, but this is outside of the Flint Hills in Kansas. This is not something that people generally do. So there is a word of caution with this. Burning is one of the most effective ways to kill ticks, especially if you burn in the spring, because you basically burn off the ticks. But really, I do urge you to check with your local authorities and rules. This is permitted in the Flint Hills at certain times of the year. Most places this isn't an option. And even if this is an option in your area, right, as we have wildfires that are now out of control in Western Kansas, don't be burning your fields if you've got no business burning your fields, right? So if you are not experienced in this, either reach out to somebody who does have experience with this or just don't do it. It's honestly, a small tick problem is not worth the risk of setting everything on fire. But if you are familiar with pasture burning, this is something that can work out. There's some tricks that you need to pay attention for when you're specifically looking at tick control. So feel free to reach out to me at any time, and we can go over what some of those are. One of the things that everybody can do is just clear brush and hedge areas. And so we generally find this is a thing that the tick's biggest problem in life is drying out. And so anywhere around trees, around waterways, there's higher humidity. And so they're just happy there. This is also an area that animals move into. If you think about it, they go down to the creek to drink water. They may lay down. We've got a whole lot of eastern red cedars, and boy, do animals like putting butts into eastern red cedars, right? So when you can just remove that habitat, it really does help with the tick. This is for us, when I talk about this in the Flint Hills, I get laughed at a little bit because, we've got very rocky ground, and the thought of putting a mower through it is just not something that we can do here. So if you do have an area that is infested and it is amenable to mowing, you can mow the grass. And really what this does is by cutting that grass short, you expose the tick to drying conditions and any hot or cold temperatures. So really what we want to do when we modify any habitat for tick control, we just want to make life difficult for it. And anytime you can expose it to extreme conditions, that really does help out. And really, I think one of the most simple things that we can do, although again, not an option for everybody, is if you get a hyper infestation on a pasture, remove cattle off that pasture. And so when we were out in Iowa, these are the three pastures. In the one where you see the rabbit, when we dragged there was a few Asian longhorn ticks. It was, mostly our native ticks, pretty normal tick numbers there. But all that's in that area, despite it being a prime tick habitat with all those trees, is we've got some rabbits and some deer. And so there's really just not the buffet that the ticks need. If you look below the rabbit, that pasture has 0 trees. And once the infestation had been confirmed, the owner actually pulled cattle off that pasture. And honestly, we couldn't find any ticks, let alone Asian longhorn tick. And then when we just hopped straight across the fence, this pasture had a lot of cattle on it. It had quite a high stocking density, and we had this super infestation of ticks, and most of them were Asian longhorn ticks. And the reason why this is that when a female tick takes a blood meal, when she gets that big gray color, the more blood she takes in, it directly translates to how many eggs she'll lay. And so if you're giving her lots of if you're giving all these ticks lots of animals to feed on, then most of them find a host, which means that most of them go on to lay eggs. Whereas if you make that host scarce, then most of them don't find a host. So you can really suppress that population by just removing your animals. This is a luxury that not everybody has, right? Not everybody has the luxury of saying, okay, well, I'm just not going to put cattle onto this pasture. And you will need at least a year of no grazing on that pasture to try and reset it back to default. The one thing that does not work is spraying. And unfortunately, this is sort of when these infestations happen, it's the first thing that everybody wants to do. So in this picture on your right, you've got a little tick that you can see in this red circle. And so the way ticks behave is that when a tick is ready to find itself a host, it will climb up the stalk of grass, and then it'll sort of wave its arms to see, is there anybody around me? And it'll wait there. And then once it senses carbon dioxide, mostly from us breathing, it'll be like, oh, there's something here I'm going to jump on. And so then as the animal brushes past that blade of grass, it then transfers onto the animal. So when you're doing a spray, this is the only tick that you would be contacting. 99% of the ticks are below that, sort of in the brush level, near closer to the surface of the soil. And so spraying is just not effective. It doesn't kill nearly the amount of ticks that you would expect it to. And also, it really does impact all the insects in the area. So all our beneficials, like our pollinators and our really insects that are important for just, birds to eat and wildlife and things like that. And so we really just want to avoid spraying. It's expensive and it really does not work. So that's kind of what you can do to control ticks in the environment. When we start looking at on-animal tick control, we really want to think about this. We will lose more money every single year to horn flies and stable flies than we will ever lose to Asian longhorn tick. And so when we see this introduced into a new area, especially if it's associated with outbreaks where we get loss in animals, that people really panic and they start doing things like they treat their whole herd with ivermectin, even though they do not have a single tick. And so we really want to be careful when we make these decisions because we don't want to cause potential economic loss in the long run because of this. And then not so much as we go further north, but there is the potential threat of New World screwworm invasion. I'm still fairly optimistic and hopeful that we will never have a case on the US soil from this outbreak. It is something that we need to keep in mind. And one of the drugs that we use for this is ivermectin. So we want to make sure that we keep this really for emergency use only. And so when I speak to producers, most people do not have a good fly rotation strategy, right? We tend to use the same product we used last year because it worked or whatever we have lying around. But really, we need to be starting to pay more attention to which insecticides we're using and have a good rotation strategy because each year the flies are getting more and more resistant and is getting to the point where we have no options left in some cases. And so I really like option one, which is using an organophosphate for 2 years, followed by 1 year of a pyrethroid, and then going back to your organophosphates. And so if you want to set up a fly rotation strategy for your herd, feel free to reach out to me. We can go over whether you like a tag, whether you like a pour-on, whether you like a spray, and then trying to figure out what would work best for you. The second option, if you have a lot of resistance, especially to your organophosphates, you can use an organophosphate in year 1, a pyrethroid in year 2, and a macrocyclic lactone in year 3. These are your ivermectins. And so when we look at the individual products, there's some things that we need to keep in mind. So an ear tag is only going to be effective if the ticks are in the ears. And so here we have this example of the bull, and he had plenty of ticks in his ears. As you remember, he also had ticks on his tail and, in between the back legs and in the armpits. An ear tag is only going to control those ticks in the ears. It is not going to control the ticks anywhere else in the body. And this is because the ear tags work by having the insecticide is impregnated into the plastic. And then as that tag comes into contact with the skin, the insecticide moves out of the tag onto the oils in the hair and then it distributes. Now, this is why we use it, and it's great for horn flies. It is also great for any ticks that are in the ears, but it's not effective for a stable fly or any other tick that is not on the ear of the animal. And so just a good practice is tag both ears because the fact is that if you only tag one ear, then you're only controlling flies on half of the body of the animal. And also, if you've got a bull with a big beefy neck and he can't move his head very well, don't even bother tagging him because it's just not going to work. One of the most effective tick control methods is spraying, especially if you have a sprayer that can reach the whole animal. And maybe you're super lucky and you have a rig like this where the animals can walk through and they're sprayed head to tail. Maybe you use a hand sprayer. It doesn't really matter what you have, but if you can spray the animal, it just allows that insecticide to reach all the areas that the tick may be. Porons are very commonly used for fly control. There's a caveat here, right? So the way a poron works is you pour it along the back line of the animal. If it is a pyrethroid poron, like your silencers and things like that, it's going to spread a little bit, but it's not going to spread enough to kill ticks all over the animal. And so we saw this in Iowa when we had really high infestation levels. We put a pyrethroid poron, and yeah, the backs of the animals look great, and the horn flies great, but the ticks anywhere else on the animal still survived. And so you want to pay attention to what kind of product you're using as your poron. In this case, a macrocyclic lactone and ivermectin poron is going to be better because it gets absorbed into the body and then it's available anywhere that the ticks feed. Now, only use this if you have a high infestation. The reason being that there's a lot of problems with ivermectins, and that we don't want to drive resistance to this. And just good practice, anytime you use any pour on, make sure that you get a nice pour from the head to the tail and get a good weight on your animals. And so the reason why I'm always hesitant with ivermectins is that you really want to think of the long game here. So our ivermectins are fat soluble, which means they're excreted over a long period of time. If you give an oral dose, it's excreted for about a month. If you give an injectable like long range, that's 5 months. It takes 5 months for that product to exit the system. Now, the problem is twofold. Number one, it'll kill all your dung beetles, right? Adult and larval dung beetles are going to get killed by this, and our dung beetles are really our last hope here because no matter how insecticide resistant a fly population will become, if the dung beetles can remove that breeding habitat, then it doesn't matter, right? So we really need to start looking out for these little poop scoopers. They really are just trying to do good work, and we just kill them with the ivermectins. And the second problem is that because of this long excretion time, it starts at a high level, and then over time that level drops. The concentration in the blood drops. You reach a point where that concentration that's in the blood is not enough to kill the fly, but it's just enough to develop your resistance genes. And we see this with nematodes too. I spoke to somebody who used long range when they had an outbreak of Asian longhorn tick. They used it for 2 years consecutively. Now they can't use ivermectins to deworm because all their worm populations are resistant. So even though there's sort of this panic, oh no, we've got the tick, let me just hit it with ivermectin. Please don't do that. If you are worried, if any of you do get the tick and you are worried, just call me. We'll walk through what our options are and how to keep track of things and how to monitor things. The good news is over time, the animal builds a natural resistance to ticks. So on the left, you see all these ticks are dark and fat, but on the right, you see a lot of those ticks are a little bit skinny and some of them are a lighter color. And this is just after one treatment of ticks, right? So over time, ticks do, because of the saliva that they put into the cattle naturally develop resistance. And so in places where we've seen hyperinfestations, their tick levels have now gone back down to normal because the animals naturally acquired resistance. So sometimes we just have to give nature time to work its way out. And so we're going to switch gears a little bit and talk about bovine Theileriosis. And honestly, this is the main reason why we care about this tick. Aside from the fact that nobody wants to see their animals covered in ticks, the animals can handle the ticks just fine. It's the transmission of the pathogen that we worry about. So we're going to talk about two scenarios here. We have outbreak scenarios, which everybody is kind of worried about and where people generally start. But then we move to something like called endemic stability. And this is something that we are already familiar with things like anaplasmosis, right? Most of your animals are infected, but you have very low rates of disease and death loss. So in an outbreak, this is the first time that the parasite is coming into your population. And here, animals old and young are equally at risk because nobody has seen this pathogen before. And we usually have severe disease symptoms when this happens, and we can have pretty high mortality rates. When we've had bad outbreaks, the mortality rates are 20% and they go even higher, right? This is a scary place to be in, right? No doubt this is scary, and we want to avoid this at all costs. So when we did the work, when we first detected this in Iowa, we went out and yes, the initial herd where we had a 20% mortality rate, this was a herd that came from Wyoming, naive, got put on a pasture that we didn't know had tons and tons of ticks on it, and so we had severe death loss. Now, what for me was interesting was that when we went and looked at the surrounding areas, it painted a bigger picture that we'll talk about in a little bit. So this is just what we get with a classical outbreak, right? Those animals that survived have not had any issues further. They're quite happy and healthy. What happens is after they have that first sort of response to it, their immune system kicks in and they start to be able to tolerate it. And we move to this position of endemic stability. So if you have a cow-calf herd, this is kind of where you will get to over time. Once we're here, our young animals are highest risk. You know, our older animals have had it. They've got a good immune response. To be honest, most of the time you see little or no disease symptoms and little to no mortality. And so we always have to be careful because you can move to an outbreak zone, but this is where you kind of settle. And so when we looked in Iowa, we took that herd that had the outbreak, but when we looked at all the herds around it on some neighboring pastures, all those animals had very high infection rates. 7 out of 8 of these herds had like no issues, right? We're still looking at 90 to 100% of these animals were infected, but we had no history of disease, no unexplainable deaths. So really this endemic stability that we call it, honestly, most people I talked to didn't even know they had Theileria in their herd because they had no indication that it was there. So it can be in a herd quite safely, and we can manage it as long as we do introductions properly. So if you are in the endemically stable zone, you just want to be careful and keep an eye out on what may trigger an outbreak. And so we want to keep an extra eye on mature, naive animals that are moving into a positive herd, right? If your herd is positive and you're bringing cattle in from out of state that are negative for it, you just want to keep an extra eye on them. Our really big high risk group are our stockers, right? A lot of these come out of the East Coast. They have it in their herds at home and they're quite fine. They get it when they're young, they get a great immune response to it, and there's no indication that anything is wrong with these animals. You put them onto a truck, you mix them with other animals that may be carrying other things. You get them in, maybe you have bad weather, just the general stress of things, and you can have a relapse. And so we see this fairly often, at least here in Kansas, where we have this very unique group that is high risk. And then you want to keep an eye out on anybody who is undergoing a high stress event. So when an animal is pregnant, the body puts itself into an immune suppressed state. It has to do this, otherwise you would abort the fetus. And so you need to stay in this immune suppressed state. Now, if you are infected with a Theileria and you are in an immune suppressed state, then that Theileria can flare up. So you want to keep an eye on these animals when they're pregnant, just after calving, and then also in animals that are young when it comes time to weaning. And so the best advice that I can really give people is sort of what this looks like and how do you know that you have it. And the first trick is that as we are learning more about this, and I always tell people, if you've had an outbreak, please call me, please tell me what you saw. Because the more people that we can have tell me what they saw, the better we can sort of paint this picture of what it would look like. What we have seen across the whole country where this has been an issue is that the disease presents very differently in our mature animals versus our younger animals. So in a mature animal, this is going to look like anaplasmosis, but the animals are not going to respond to treatment. You're going to think it looks like maybe they've got anaplasmosis. You'll hit them with the antibiotics. Nothing's going to happen. And so often when we read the fact sheets and things like that, they talk a lot about this anemia, right? You'll see pale membranes and things like that. This is really later on in the disease. And so people often only notice it once it gets to this point. And honestly, sometimes when we're at this point, it's really hard to bring the animal back. So what I want you to pay attention to, any loss of appetite or weight loss. This is the canary in the coal mine. It's the first thing that we see. So if you see an animal going off feed, that's a trigger that something is wrong and you want to pay extra attention to her. You will also notice that the animals are lethargic. They may sequester off to the sides. They're very exercise intolerant, right? So they don't want to get up. They don't want to move. And this in contrast to anaplasma, where you can sometimes see a little bit of aggression. These animals are not aggressive. They're just really just down and dumpy, and they just do not want to move or do anything. If you have a temperature handy, you can check for a fever. A fever is one of those hallmarks of infection. You can also see them coughing. We see a lot of lung involvement with Theileriosis in general. And so maybe the head might be hanging down and they may struggle to breathe. And we also do see late stage abortions associated with this in our cows. Now, this is in contrast to our sort of animals who are 6 months and younger. It's going to look like pneumonia that doesn't respond to treatment. So again, you're going to have the fever. Again, the first thing that we see is that they get kind of a snotty nose and they stop eating. You can also see an elevated respiratory rate. They may breathe a little bit shallower because they're really struggling to breathe. And again, you're going to hit it with an antibiotic and it's not going to respond to that. And so really just knowing the age of the animal and keeping your eye out for slightly different things is important. So there's no approved drug for Theileria. A drug does exist. Merck has put in the paperwork to get emergency authorization to use it. We're fairly hopeful that it'll come out onto the market. There's issues with it, has a long residual time and things like that. And so, for now, we just don't have anything to treat it with. All our evidence is anecdotal. We haven't been given money to do actual trials to say, oh, does this work? Does this not work? So all of what we've gathered is from producers telling me, hey, I did this and it seemed to work or it didn't seem to work. The trends that we've noticed is keep the animals eating, right? So when we have disease pathology, it's an inflammatory response. And as you guys know, inflammation, it has a role and it's good, but sometimes it's really, really bad. And so what we don't want is this sort of systemic inflammation in the body. And so when animals stop eating, then you have issues with gut inflammation and you get acidosis. And so you don't want the animals having to deal with this on top of their Theileria infection. So put the most palatable thing in front of them, try and keep them eating. We really do find that does help. Have a good relationship with your veterinarian, right? And I really, this cannot be underestimated because you want to know that if you can call him up and he says like, hey, I've got this animal that's down, can you come take a look? That he'll be out there the first chance he gets. You don't want to be scheduled in sort of 3 or 4 days later because time is really of the essence with these animals. And so, have a good relationship, make sure you pay your bills and just, know that they can come out. There's a couple of things, the last two things that we're going to talk about require a veterinary prescription, right? So there is some evidence that maybe using a long-acting tetracycline can help with the secondary infections, especially in our younger animals, but it will not cure an animal. Steroids have been used by some veterinarians to kind of reduce the inflammation, and so that's an option. Banamine, which is like, us taking an ibuprofen, it gets the fever under control. It also removes pain. And so much how we feel really crummy when we have the flu, we take a pain reliever, we feel a little bit better. If we can have them feeling a little bit better, we can get an improvement in that appetite. They can start eating and we can kind of get them in a better place to sort this out. And I'll also say that we've got to be careful of this sort of correlation and causation issue. Sometimes people will be like, oh, I vaccinated with this completely unrelated thing and I had no problems. The next time I brought them stockers in and I didn't vaccinate and I had problems. It's probably not the unrelated vaccine. It's just sometimes hit and miss as to what goes on. So I always say keep keep a note of these cause, these correlations between things, but sometimes, we jump to conclusions and things aren't really related. I will say probably one of the most important things that we need to do is, this is just a matter of weathering the storm, and it's how we move forward as a community. I've spoken to a lot of producers who are, they want to buy an animal and they're very close to buying the animal, and they say, "Oh, can you test the animal for us?" Turns out it's positive for Theileria, and then the sale falls through. And then I speak to the buyer and say, "Oh, well, you're on the East Coast. How do you know that you don't have this?" And they say, "Oh, well, I haven't had any losses." Say, test your animals. Then they find out that they already have it, right? So we really want to remove the stigma of having the tick or the pathogen. You did nothing wrong. It's going to eventually become prevalent across the whole United States. So if you have positive animals, keep your positive animals, right? This is a way that you can get stable as soon as possible. I had one person who they brought in a bull, and it's the best bull they've ever had, and it's got great genetics, and they're really, really excited about it. And they wanted to know, well, should we breed it and then cull it after this winter, right? Let's not be culling animals with great genetics just because they're infected, right? Turns out their herd was already infected anyway. So really just take a deep breath, give me a call. We can walk through these scenarios. We want to be vigilant, right? Keep an extra eye out on our animals, but we don't need to panic. This is something that is manageable, and we can find ways through this. And really just buy and sell cattle as usual. We want to be cognizant of our risks, but not necessarily panic by them, and stopping good relationships that we have with suppliers and things like that. I do recommend testing your animals, especially if you are in a situation where you regularly have animals that are coming in from out of state. If you have your neighbor who's bringing in animals from out of state, right? If stable flies can transmit this, as we suspect they can, a fly can fly a couple of miles, right? So we want to just be aware of what our herd has. I try to do everything in my power so that producers don't spend any money. But this is a case where I actually do think that this is worthwhile doing. So know your herd status, right? It's about $30 a sample. Most states you can go through your state diagnostic lab to test it. There's no magical number on how many you need to test. I say if you've got a small herd, try and test as many as possible, because if you have a small herd and a low infection rate and you only test a couple of animals, you could lose, just by chance, miss that one or two animal that already has it. If you're in a larger herd, 50 to 100 cows, I would say test between 10 to 20% of them. That should give you a good snapshot. Once an animal is positive, it will remain infected for life, and so you do not need to retest that animal, right? So it's infected, it'll stay infected. Always test new animals coming into the herd, whether you have it or not, right? If you do have a positive herd and this animal is negative, you want to keep an extra eye on it. If your herd is negative and this animal is positive, you need to know that so that you can watch it as it transmits throughout your herd. So knowing where you're at is honestly the best thing you can do, because number one, you're no longer wondering whether you have it. And number two, we can set up a good plan for how we move forward and keep this stable. And so I am in Kansas, but last year I provided extension services to 15 other states, right? So just because you're in Wisconsin doesn't mean that I'm not happy to hear from you. So please do reach out anytime, whether it's ticks or flies or anything under the sun. I'll leave that up there for a second so that you can take a screenshot or write it down or do whatever you want to do. And